2026 Mental Health Status Examination Practice Review. Question 1. Which therapeutic approach is most effective for managing borderline personality disorder? Option A. Dialectical behavior therapy. Option B. Cognitive behavioral therapy. Option C. Psychoanalysis. Option D. Supportive therapy. The correct answer is option A. Dialectical behavior therapy. Dialectical behavior therapy (DBT) is considered the most effective therapeutic approach for managing borderline personality disorder. DBT is a specialized form of cognitive behavioral therapy that focuses on. Question 2. The mental health team is determining treatment options for a male patient experiencing psychotic symptoms. Which question shouldn't the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Option A. Is the patient expressing suicidal thoughts? Option B. Does the patient have intact judgment and insight into his situation? Option C. Does the patient have experiences with either community or inpatient mental health care facilities? Option D. Does the patient require a therapeutic environment to support the management of psychotic symptoms? The correct answer is option C. Does the patient have experiences with either community or inpatient mental health care facilities? Assessing suicidal thoughts, judgment, insight, and the need for a therapeutic environment are crucial factors in determining the appropriate treatment setting for a patient experiencing psychotic symptoms. Passed. Question 3. Which therapeutic intervention is most effective for social anxiety disorder? Option A. Group therapy. Option B. Behavioral rehearsal. Option C. Cognitive behavioral therapy. Option D. Medication management. The correct answer is option C. Cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is considered the most effective therapeutic intervention for social anxiety disorder. CBT helps individuals identify and change negative thought patterns and behaviors associated. Question 4. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A. Deep breathing exercises. Option B. Physical exercise. Option C. Mindfulness meditation. Option D. Journaling. The correct answer is option A. Deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the botus relaxation response, leading to. Question 5. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A. Haloperidol. Option B. Fluoxetine. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 6. Which statement made by the patient demonstrates an understanding of the treatment of choice for patients managing the effects of traumatic events? Option A. I attend my therapy sessions regularly. Option B. Those intrusive memories are hidden for a reason and should stay hidden. Option C. Keeping busy is the key to achieving mental health. Option D. I've agreed to move in with my parents so I'll get the support I need. The correct answer is option A. I attend my therapy sessions regularly. Regular attendance at therapy sessions is a crucial aspect of the recommended treatment for managing the effects of traumatic events. Therapy provides a safe space for individuals to process their experiences. Question 7. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A. Monitor the patient's vital signs frequently. Option B. Keep the patient distracted with group-oriented activities. Option C. Provide the patient with frequent milkshakes and protein drinks. Option D. Reduce the volume on the television and dim bright lights in the environment. The correct answer is option B. Keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable. Providing nutrition, such as milkshakes and protein drinks. Question 8. In addition to anti-anxiety agents, which classification of drugs is commonly prescribed to treat anxiety and anxiety disorders? Option A. Antipsychotics. Option B. Mood stabilizers. Option C. Antidepressants. Option D. Cholinesterase inhibitors. The correct answer is option C. Antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors (SSRIs) and serotonin norepinephrine reuptake inhibitors (SNRIs), are frequently used in the treatment of anxiety disorders. These medications help. Question 9. When patients diagnosed with schizophrenia suffer from anosognosia, they often refuse medication, believing that Option A. Medications provided are ineffective. Option B. Nurses are trying to control their minds. Option C. The medications will make them sick. Option D. They are not actually ill. The correct answer is option D. They are not actually ill. Anosognosia is a lack of insight that affects patients with schizophrenia, leading them to deny or lack awareness of their illness. This lack of awareness often results in patients refusing medication because they. Question 10. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A. Flashbacks. Option B. Nightmares. Option C. Hypervigilance. Option D. Depression. The correct answer is option B. Nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of. Question 11. A female patient diagnosed with schizophrenia has been prescribed a first-generation antipsychotic medication. What information should the nurse provide to the patient regarding her signs and symptoms? Option A. Her memory problems will likely decrease. Option B. Depressive episodes should be less severe. Option C. She will probably enjoy social interactions more. Option D. She should experience a reduction in hallucinations. The correct answer is option D. She should experience a reduction in hallucinations. First-generation antipsychotic medications are effective in reducing hallucinations in patients with schizophrenia. These medications primarily target positive symptoms such as hallucinations and delusions. Question 12. Kyle, a patient with schizophrenia, began taking the first-generation antipsychotic haloperidol, Haldol, last week. One day you find him sitting very stiffly and not moving. He is diaphoretic, and when you ask if he is okay, he seems unable to respond verbally. His vital signs are BP 170/100, P110, T104.2 a degree F. What is the priority nursing intervention? Select one that does not apply. Option A. Hold his medication and contact his prescriber. Option B. Wipe him with a washcloth wet with cold water or alcohol. Option C. Administer a medication such as benztropine IM to correct this dystonic reaction. Option D. Reassure him that although there is no treatment for his tardive dyskinesia, it will pass. The correct answer is option C. Administer a medication such as benztropine IM to correct this dystonic reaction. The patient's symptoms, including stiffness, diaphoresis, inability to respond verbally, and vital sign abnormalities, are indicative of neuroleptic malignant syndrome NMS, a serious and potentially. Question 13. During a routine health screening, a grieving widow whose husband died 15 months ago reports emptiness, a loss of self, difficulty thinking of the future, and anger at her dead husband. The nurse suggests bereavement counseling. The widow is most likely suffering from Option A. Major depression. Option B. Normal grieving. Option C. Adjustment disorder. Option D. Post-traumatic stress disorder. The correct answer is option C. Adjustment disorder. The widow's symptoms align more closely with an adjustment disorder rather than major depression, normal grieving, or post-traumatic stress disorder. The widow's prolonged struggle in coping with the loss. Question 14. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states, Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 15. In assessing a patient for signs of serotonin syndrome, which of the following symptoms would be consistent with this condition? Option A. Hypotension, bradycardia, hypothermia. Option B. Hypertension, tachycardia, hyperthermia. Option C, hypotension, tachycardia, hypothermia. Option D, hypertension, bradycardia, hyperthermia. The correct answer is option B, hypertension, tachycardia, hyperthermia. Serotonin syndrome is characterized by a triad of symptoms: hypertension, tachycardia, and hyperthermia. Therefore, the correct answer is B, hypotension, bradycardia, and hypothermia. Choice A are not typical. Question 16. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A, teach the patient relaxation techniques. Option B, gradual exposure to feared situations. Option C, encourage the patient to attend social gatherings. Option D, provide education about the disorder. The correct answer is option B, gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home. Common. Question 17. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A, lithium escalate. Option B, clozapine, clozaril. Option C, diazepam, Valium. Option D, amitriptyline. The correct answer is option A, lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 18. What should the nurse include in patient education for a patient starting on bupropion for major depressive disorder? Option A, avoid consuming alcohol while taking this medication. Option B, take the medication in the morning to prevent insomnia. Option C, it may cause significant weight gain. Option D, it is used as a first-line treatment for anxiety. The correct answer is option A, avoid consuming alcohol while taking this medication. Patients prescribed bupropion should be educated to avoid consuming alcohol while on this medication to reduce the risk of seizures. Bupropion lowers the seizure threshold, and alcohol can further increase this risk. Question 19. In managing a patient with anorexia nervosa, which initial treatment goal is most important? Option A, addressing distorted body image. Option B, restoring nutritional status. Option C, resolving family conflicts. Option D, increasing social interactions. The correct answer is option B, restoring nutritional status. The most crucial initial treatment goal for anorexia nervosa is restoring nutritional status. This is essential to prevent life-threatening complications associated with severe malnutrition, such as organ damage and. Question 20. For a patient diagnosed with borderline personality disorder exhibiting self-harming behavior, which therapeutic approach is most appropriate? Option A, dialectical behavior therapy. Option B, psychoanalysis. Option C, supportive therapy. Option D, pharmacotherapy. The correct answer is option A, dialectical behavior therapy. The most appropriate therapeutic approach for a patient diagnosed with borderline personality disorder exhibiting self-harming behavior is dialectical behavior therapy (DBT). DBT is specifically designed to address. Question 21. Luke's family comes home one evening to find him extremely agitated, and they suspect he is in a full manic episode. The family calls emergency medical services. While one medic is talking with Luke and his family, the other medic is counting something on his desk. What is the medic most likely counting? Option A, hypodermic needles. Option B, fast food wrappers. Option C, empty soda cans. Option D, energy drink containers. The correct answer is option D, energy drink containers. During a manic episode, individuals often exhibit symptoms such as hyperactivity, decreased need for sleep, and excessive involvement in activities that can have harmful consequences, such as overconsumption of. Question 22. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A, excessive sleeping. Option B, low self-esteem. Option C, decreased need for sleep. Option D, anhedonia. The correct answer is option C, decreased need for sleep. The correct answer is C, decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 23. A patient with panic disorder is prescribed a benzodiazepine. The nurse should educate the patient that this medication is typically used for. Option A, for long-term maintenance therapy. Option B, as a first-line treatment. Option C, for short-term use due to the risk of dependence. Option D, to treat depression symptoms. The correct answer is option C, for short-term use due to the risk of dependence. The correct answer is C for short-term use due to the risk of dependence. Benzodiazepines are usually prescribed for short-term relief of anxiety symptoms due to the risk of dependence. Prolonged use can lead to. Question 24. In what order should the following goals be approached for a client being treated for alcoholism? Option A. Learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C. Abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D. Abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 25. Cognitive behavioral therapy, CBT, is often used to treat which of the following conditions? Option A. Schizophrenia. Option B. Bipolar disorder. Option C. Post-traumatic stress disorder. Option D. Generalized anxiety disorder. The correct answer is option D. Generalized anxiety disorder. Cognitive behavioral therapy (CBT) is a widely used therapeutic approach effective in treating various mental health conditions. While CBT can be beneficial for different disorders, it is particularly well suited for